Dr. Dinesh, sir. He has been pioneer in himself. So, sir, I would like to know what are the latest advancements, sir, in relation to AI, just to continue what Dr. Gupta said, sir.
So AI, as we all know, used to be called artificial intelligence. Now people don't like to use the word artificial because there's nothing artificial about it. It is augmented intelligence. And I have been doing a lecture, public lecture, since 2018. I think the first one I did was in India Habitat Center. And the title was A World Without Doctors. But it was a provocative title, and I would add the subtitle, there is going to be a world without doctors who don't work with AI. So I think that is the core message. Coming to your specific question, what is happening? Radiology has been in the forefront for AI because it's an image-based specialty, and AI pattern recognition is very easy to do in a digital image. And now with machine learning, the computer learns itself. The algorithm is written initially, and then it learns its own mistakes and corrects the mistakes. So many of the research which was done from late 90s, 1990s, 2000, until about 2017-18, the radiologists were performing better than the machines. 2018, the graph crossed. There's a very good article in Nature which has shown that graph. And now the AI is significantly better in many fields. It's not that they can do everything. And I think that's the fear that most doctors have, oh, AI is going to take over. No, it's not. AI is like a co-pilot. So it will help you, and especially when there is a repetitive work, that something is, for a human being, it's boring because you keep doing the same thing again and again and again and you do mistakes. For AI, that's not a problem. So things like screening for the breast cancers. My specialty, ophthalmology, was probably the second one coming into this. And there are so many programs now. Google's DeepMind started a program in 2014 involving Moorfields Eye Hospital's 20 top ophthalmologists. Moorfields is one of the most reputed hospitals. And DeepMind on one side was looking at the retinal images and OCT, the optical coherent tomography. And on the other side were 20 ophthalmologists without knowing who is doing it, so like a double-blind trial. And the first result showed that the AI matched exactly what the ophthalmologists were doing. And after 2 years, they looked at the same data again, same patients, and what has happened to them 2 years later, and AI performed better than the ophthalmologists. So what AI had predicted was, they turned out to be right, the doctors were wrong. So ophthalmology is an area, and just last month, FDA has approved one of the first software programs, algorithms, AI-based, for diabetic retinopathy screening. As Dr. S.P. Madhu mentioned, diabetes is a real challenge, and screening for diabetic retinopathy is a huge challenge, especially for India. With the manpower that we have, we cannot cope with doing real effective screening. So this software looks at the retinal image and it is giving a diagnosis with the grading. And I'm very proud to say that I was involved in this research in 2003 when I was working at Doheny Eye Institute. And at that time, the digital imaging had just started. And we had a challenge that who is going to look at all these images, because ophthalmologists are busy doing their surgery and looking at patients. So what we did was we took some school leavers, people who have just come out of school, no medical training, and we taught them to look at images and just put in an algorithm, which I had written with my software team, to say whether they can see yellow spots in which quadrant, right? Red spots, which quadrant. As simple as that. and the algorithm produced a international classification of diabetic retinopathy based on those things. So that was first semi-automated diabetic screening tool. And now, obviously, it has reached this stage. So ophthalmology is one, and one company, as I said, is, I think it's called Luminatic Core. It's a Toronto-based company, and FDA has approved, and they have a coding, because in America, and even now in India with insurance companies, coding is very important. Other fields, medical records already been mentioned about digital health. Now you can dictate not just a letter, but anything about patient's history, and it converts itself into a proper record. So that is all automated. Other fields are cancer research, not research, cancer treatments. So there are software which are looking at the brain scan images, and they calculate the contours of the brain tumor or whatever lesion there is, and the surgeon can see all those images during the surgery, and with the help of robotic surgery, they can do a very, very precise job. Gastroenterology, again, there are programs for polyps to recognize using AI, and they are much more accurate than what the doctors were doing. So these are the fields which are coming up in recent years.